The other one you were talking about with growth hormone, and you gave us some of those nice anecdotes, some of the studies that have been done. And there's been a lot of certainly banter in the newspapers about baseball players taking growth hormones, in particular a home run record that has been tainted by what seems to be pretty well-documented testimony that growth hormone and other kinds of, let's say, pro or anabolic types of drugs were being used. But nonetheless, there are also lots of things advertised in health food stores, on the internet, that say they will boost your growth hormone levels. And what impact do they have? Are they real? Is there anything about it? Is there anything out there that people should be taking, or should they be avoiding it?
Well, first let's start with non-pharmacological approaches to problems with growth hormone. Again, if you're not getting enough sleep, you're not going to have adequate growth hormone secretion. Nutritionally, the best thing you can do to increase growth hormone secretion is to eat more protein and decrease the amount of sugar that you eat. That's been shown also. There are some oral protein substances, amino acids like arginine, that in some cases seem to help growth hormone secretion. IV arginine is used as a growth hormone challenge test. Actually will stimulate growth hormone from the pituitary, but the amount that you have to take orally is so high that it may not be tolerated. But what you're talking about is, let's just drop back a little bit. Growth hormone comes from the pituitary. It's stimulated to be released by a hormone from the hypothalamus, or part of the brain, known as growth hormone releasing factor. And the growth hormone itself goes to the liver and creates a third hormone that we refer to as IGF-1, which actually does most of the work. And so we commonly, when we measure growth hormone levels, we measure IGF-1 levels. The reason is that growth hormone itself has a very short half-life. It's hard to measure it, and you have to measure it at 2 o'clock in the morning. So a surrogate for growth hormone is IGF-1 levels. That's what we're measuring. So there's several approaches. In 1985, I believe, we were first able to have synthesized human growth hormone. And in the early 90s, several companies produced recombinant human growth hormone that are used, certainly in kids. You should know about that. And a relatively newly recognized syndrome in adults known as adult growth hormone deficiency. And one little aside, growth hormone is the only medication in the whole U.S. pharmacopoeia, or, universe of medicines, that there's actually a federal law against prescribing it off-label. What I mean by that is, that blood pressure medicine that you take? Once that blood pressure medicine is approved, any doctor could take that one, or whatever it is, and prescribe it to a patient for nasal allergies. It's crazy, but in other words, the doctors can basically take any approved drug and use it for any condition. But that's not the case for growth hormone. So walking into a doctor's office and saying, "I think I'm aging, please give me growth hormone," if that doctor doesn't do things to document that you truly are deficient in growth hormone, the doctor could be thrown into jail. So it's actually illegal to prescribe growth hormone off-label. And a lot of this is stemming from the abuse from athletes. That's not the case for testosterone, by the way. So again, I'm not saying that you should just walk in and ask for testosterone, but it's very unique to growth hormone. So that's the recombinant growth hormone that this applies to. But what Russ was talking about is there's other ways to get growth hormone to be secreted. That hormone that I was talking about, the growth hormone releasing factor, that's a legitimate medicine. It was FDA approved. I don't know if you remember Gerif. Did you ever remember that when you were taking care of kids that didn't grow? Gerif was growth hormone releasing factor, and that's an FDA approved preparation that will stimulate growth hormone from the pituitary. Interestingly enough, there isn't a law against that, so it's kind of schizophrenic. Again, I'm not saying you should go in and ask for this, but there are other ways to increase growth hormone other than just giving growth hormone itself. Another are what we call secretagogues. Now, you were talking about all those hokey things you see. There are a number of legitimate secretagogues that have literature that I can show you that controlled studies that show they raise IGF-1 levels. There's a product called secretropin. Secretropin, there's a website actually, and there's several studies that show it increases, and it is not a hormone, it's a preparation of amino acids and some other stuff. But I would say that most of our experience with the secretagogues, that is something to stimulate the pituitary, have been kind of hokey, and you have to be very careful about what you're taking.